So how do you help people train to be able to do that in the moment?
Yeah, so we coach patients. We see that there is potential for them to do deep inspiration breath hold. We'll give them virtual reality education on the treatment technique.
This brings us to your toy that you brought with you. So is the VR about just showing patients what it's going to look and feel like when they're undergoing this procedure that might be the first time they've ever experienced it?
Yeah, that's exactly right. So a lot of patients...
What a cool idea.
Yeah.
So I'm going to put this on my face.
Yeah.
And then you're all going to be able to see what I can see, right? Okay.
Hopefully.
All right. Okay. I'm in the room.
Breathe normally for
All
me.
right. So here we are in the
Breathe
room.
normally for me for a little bit.
Hi, Kath.
Just take your breath
So when I
all the
told
way
you
back
guys
down to
before
that
about
blue line.
lying on your back and with your arms up, that's a typical way of how we set up patients. So this patient in particular has goggles on,
when you're ready,
and that
take a
yellow
big deep
line
breath up to that box.
represents her breathing.
You to hold for 15 seconds.
And then we want her to hold a deep breath into that box and just hold it in there. So some patients do have anxiety because before, if they don't know what they're going into, they would just come in and we'd say, okay, now we need you to take a deep breath in and hold your breath and hold it in this particular way. And a lot of patients, well, many patients will get quite anxious from it. We had some patients who were quite distressed as well, and they would be crying through this whole process, and it would be, you know, distressing for us to see them go through that.
How useful this is to achieve the clinical outcome that you're looking for.
Sure. So a lot of patients now come to us and say that their fear of the unknown has been completely obliterated. So they know exactly what they need to do. So the anxiety is reduced as well. So in our pilot, we did have a statistical significant difference showing that anxiety had been reduced from the virtual reality education. Yeah.